Hello, and welcome to KPHA's Advocacy 101, where we'll walk you through the legislative process in Kansas and how you can help advocate for your profession. As most people who are active in the political process are fond of saying, if you're not at the table helping to make decisions, you're on the table. We appreciate that you're willing to come to the table with us and advocate for your profession, your community, your coworkers, and your patients. I'm willing to bet that most of you have already advocated or been an advocate for pharmacy this week. If you've educated a patient about something you can do to help improve their well-being, or told a neighbor about the challenges of operating as a pharmacist within our current insurance system, congrats, you're already an advocate. It's really not any different to take this to the next level and tell your legislator that same story. So to find out who represents you, hop over to pluralpolicy.com and go to Find Your Local Legislators. Enter your home address to find who represents you. This will then pull up the people who represent you and your neighbors in both Kansas and Washington, D.C. We're going to focus on the top two folks today, our state legislators. Everyone in Kansas is represented by someone from the upper chamber, the Senate, and someone from the lower chamber, the House. In this case, we're represented in the upper chamber by Senator Brenda Dietrich and in the lower chamber by Representative Kirk Haskins. To learn more about that person, check first that you're in the correct session. You can find someone by going to Find Your Legislator and entering their name and then clicking on Find Legislator. Or if you don't remember how to spell it, I usually go to the Legislators tab and check out the roster for that chamber. In this case, we're looking for a Senator Brenda Dietrich, so we'll click on Senate roster. We'll then click on Senator Dietrich, and from there, you can learn a lot about that person, including looking at the committees that they serve on, or have leadership in. You can see how they voted in the past, and then how to contact them. You can even look at their profession or what they do when they're not representing you in Topeka. In Kansas, we have a real Dr. Seuss book of professions. You can find teachers, farmers, physicians, and barbers, but as of today, no pharmacists. So how does a bill become a law? If only Schoolhouse Rock was accurate. In Kansas, an idea is turned into a bill, and then the bill walks its way through both the upper and lower chambers and is then signed by the governor. As a quick example, a bill allowing pharmacists to prescribe tobacco cessation products could be introduced into the House Health and Human Services Committee, voted by those representatives to pass out of committee. Then the exact same bill is introduced and passed out of the Senate Public Health and Welfare Committee. Both chambers then put the bill on their calendar, and both senators and representatives vote to pass this bill. It then goes to the governor's desk, and she signs it, instructing the Board of Pharmacy to write regulations to go along with the bill. Easy, right? In reality, nothing is simple about the legislative process, and it's more of a game of chutes and ladders, where there are a lot of chutes and really no ladders. There are a lot of places in the process where good ideas go to die. While this is an image of the federal process, the Kansas system works in a nearly identical way. And you'll see on here that every black star with a red hand is a place where a bill can either be killed or left to languish until the session wraps up. This is why it's so important to be involved with your state association, as well as to have contract lobbyists who understand the rules of this complicated board game, are in the Capitol every day, and can help guide your bill through the process. It's always important to educate your representatives on what's important to you, but when there's a bill that's important to the profession, there are a few times that it's really critical to advocate for that bill. These are the times that the Kansas Pharmacists Association will email and ask you to reach out to your legislators. Sometimes we know that we have the votes to sail through a committee hearing, or we know that maybe all of the legislators are in support of this and it's going to pass that chamber floor. But other times, maybe it's in that second chamber, there's somebody very much against it. It's going to be very important to reach out to the people that serve on that committee or maybe are seeing that in their chamber to let them know that we and you support that bill. And I know, it's really easy to get intimidated by the idea of reaching out to someone in Topeka, but remember first, they live and work in your community, so you're educating your neighbor. They're likely a teacher or a farmer, and they want to help. So whether you're writing a letter, sending an email, reaching out on social media, or sitting down with them for coffee at your local cafe, there's a really simple formula here. Who are you? Why is this important? And what should they do or what can they do to help you? So let's look at some examples of how we can piece this formula together Mad Lib style. First, let them know who you are. Your thoughts will matter way more if you live in their district. Sometimes we'll ask you to write to your committee or chamber leadership and copy who represents you as well, so they can know what's important to you and maybe they can help you by talking to leadership. Next, give your representative some information on why this topic is important to you and your community. Maybe it's unfair contracts that will force your pharmacy to close its doors if nothing changes. Maybe it's overregulation that restricts you from taking care of your patients in the way that you were trained to do. Maybe your hospital is losing pharmacists and technicians to a hospital across state line because they can afford to pay more with expanded Medicaid. Last, end your outreach with a specific call to action. What this legislator can do to help solve your problem. This is where it helps to know where the bill is at in that complicated board game. Because sometimes your legislator is critical to getting that bill passed out of committee. Sometimes you're just letting them know that they're going to see this bill in a vote on the Senate floor tomorrow, and you want them to vote against that bill because it could hurt the practice of pharmacy. So note that none of this needs to be a multi-page essay or an hour-long meeting. There's no way either you or they have time for that. A few short sentences can really help them get the idea, especially if they're hearing it from every single person who works in a pharmacy who lives in their district. There's power in unified message and a lot of power in numbers. So now that you know that formula, you're ready to act. We know that you're all Midwestern nice, but always keep in mind that these folks are your neighbors and most of them want the same thing you do. Remember that KPHA's Advocacy Day is just one day, and that working with legislators is a long-term relationship. While an email can be a start, KPHA is there to support you as you advocate throughout the year. Now that you know how to request support for a bill, you can take more steps, so your legislators know that you're a source of information about pharmacy and healthcare, and you're ready and willing to help make Kansas a better place to live and to practice pharmacy. Congratulations! You know how to advocate for Kansas pharmacy. Be sure to follow us on social media, and especially during legislative session, keep an eye on your inbox for advocacy alerts. You can also check out the advocacy session of our website to learn more about our legislative priorities for the year and any upcoming events. Thanks for being an advocate.